I'm John Marino, Senior Editor with The Deal, and I'm joined today by Dan Hosler, who's a principal with Sterling Partners covering healthcare. We've seen kind of a dip in healthcare M&A activity, specifically coming from private equity buyers over the course of 2013. Well, what do you say accounts for that?
We think at this point, if you really haven't sold your company by now, it's almost too late. You had 3 or 4 years where both Congress and IRS were talking about tax changes. And so if you really haven't capitalized on it, and we saw that big uptick in activity right at the end of 12, we think that's accounting for a lot of the dip right now. Although lately there's been a lot of activity, so we think it's just starting to bounce back.
And do you feel like some, I guess, more certainty regarding the Affordable Care Act might provide buyers and sellers with a little bit more clarity to operate from themselves? I mean, we've kind of seen a series of delays now that really weren't anticipated.
It certainly could be the case. I would almost take it a different direction in that the lack of clarity is going to create a lot of opportunity in the near term. And frankly, finality of the Affordable Care Act might actually see a decrease in deal activity. And so with lack of implementation of the exchanges, delays, funding issues, could actually create more opportunity as more businesses get created and more opportunities for what Sterling likes to look at.
All right. What are some of maybe the more robust sectors that you would see activity for? I mean, for example, we've seen a lot of activity in CROs, but really not in other spaces.
Yeah, we think some of the more exciting spaces are certainly around healthcare services. And so if you think about the payer universe, the providers, those lines are really getting blurred. And so we think there's a lot of opportunities where you can really help both of those constituents work together with greater pricing transparency, with greater collaboration. That's really where there's going to be a lot of activity.
All right, and how about, for example, hospice care? Where exactly, how far into the future maybe, is that going to be a really viable business model for PE?
You know, I keep wanting to say the answer is no, but then more and more deal activity gets done. If you just think about the number of seniors that are coming into Medicare every single day, I think the number is like 10 or 11,000 new Medicare members every single day. And that's going to continue to take place for the next 15 plus years. But the bigger issue is, how are you actually going to provide those services to those people? Hospice, a lot of it is still done in-home. But if you think about the skilled nursing space or some other areas where they're still facility-based, we think that eventually telemedicine is going to have a bigger role, but we're just not quite sure when that's going to take place. But certainly seems like a lot of opportunity, just given the macro trends and the demographics.
That seems like that should be pretty interesting too, but thank you very much for joining us today.
Thank you.
I'm John Marino, Senior Editor with The Deal, and I'm joined today by Dan Hosler of Sterling Partners, who covers healthcare. We've kind of seen a bit of a dip in the M&A activity in the healthcare space over 2000.